Are flat feet inherently bad feet or more prone to injury than other foot structures? Probably not. Injuries often have a variety of factors. However, especially when it comes to running, foot structure shouldn't be overemphasized, and here's why. Foot structure is a easy characteristic to observe, and depending on the athlete in front of you, they're going to have a different structure. Pes cavus is the medical terminology for somebody with a higher arch. Pes planus, on the other hand, is somebody with flat feet or somebody with less of an arch. Outside of just visual observation, foot mapping is often used for somebody to observe how they're distributing their weight in each foot. While this is a nice visual demonstration, a nice tool to show how we statically place our weight on each foot, it does nothing to show how we move dynamically. When we watch somebody walk or run and we're trying to measure pronation, it's going to be hard to do from visual observation alone. What are we actually looking at? Hind foot pronation, midfoot, forefoot pronation. Watching somebody walk and how much somebody does or does not pronate and how it's linked to somebody's specific injury is not a reliable measure. This becomes less reliable when we consider foot slippage within a shoe or even within a sock. Pronation is a normal motion of the foot and allows us to accommodate to the potentially unstable surface beneath us. In fact, some levels of pronation is actually advantageous and guards us against injury. There are 33 joints and 26 bones in each foot for a reason. Specifically, all these joints and bones allow our foot to become a flexible adapter when we pronate. Becoming more flexible allows us to accommodate for our own body weight as well as the potentially unstable surface beneath us. Supination, or everting the foot to move more onto the lateral outside portion of the foot, is also a normal motion. Supination of the foot allows our foot to become a rigid lever. This allows the foot and lower extremity to become in a more advantageous position in order to propel us into our next step or stride. While there are specific measures that are going to link pronation and or supination to specific injuries, neither are inherently bad. A flatter foot, or pes planus, is going to be a more lax foot. It's going to have more motion and technically be more vulnerable to a soft tissue injury. More stability work might be good for this foot in order to increase the soft tissue stability. For example, the posterior tibialis muscle, or the main dynamic stabilizer of that medial arch, might be a good structure to work on if somebody is focused on increasing the stability of a flatter foot. Pes cavus, or a higher arch, might be more vulnerable for a bony injury because it tends to stay in a more rigid position. More mobility might be good for this foot because it stays in a rigid position as opposed to going into pronation where it becomes more flexible. Something to keep in mind, everybody's going to have their own unique running pattern based on a variety of factors such as running history and medical history. Everyone's going to stand a little different and have a slightly different foot structure. It's not necessarily pathological. Personally, I most certainly supinate much more on my right side. That has to do with a variety of factors. This likely includes several ankle sprains on that right side, a history of left Achilles issues, as well as a mobility deficit into dorsiflexion on that right side as well. Either way, it's not something that I focus on, I'm aware of it, but it's not something that I try and intervene directly on. Are flat feet inherently bad? No. Your foot structure, or how you stand statically, is more of a characteristic than something that might lead you to an injury. Foot structure and how the foot lands are small factors.